This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: what is the mode of inheritance for Marfan syndrome? Answer: Marfan syndrome is inherited in an autosomal dominant manner. Question: what is the typical intellect of people with Marfan syndrome? Answer: people with Marfan syndrome typically have normal intellect. Question: what are some common vascular complications associated with Marfan syndrome? Answer: aortic root dilatation is a common vascular complication associated with Marfan syndrome. Question: where is the lens dislocation commonly located in people with Marfan syndrome? Answer: in people with Marfan syndrome, lens dislocation is commonly located upward, temporal, as a mnemonic Marfan fans out. Question: what is the mode of inheritance for homocystinuria? Answer: homocystinuria is inherited in an autosomal recessive manner. Question: what is the typical intellect of people with homocystinuria? Answer: people with homocystinuria typically have decreased intellect. Question: what are some common vascular complications associated with homocystinuria? Answer: thrombosis is a common vascular complication associated with homocystinuria. Question: where is the lens dislocation commonly located in people with homocystinuria? Answer: in people with homocystinuria, lens dislocation is commonly located downward, nasal. Question: can you provide more information about Marfan syndrome? Answer: Marfan syndrome is a genetic disorder that affects the connective tissue in the body. This can lead to problems with the heart, blood vessels, bones, joints, and eyes. Common symptoms include tall and thin build, long fingers and toes, a curved spine, and a sunken chest. It is inherited in an autosomal dominant manner, meaning that a person only needs to inherit one copy of the affected gene to develop the condition. Question: what are the common signs and symptoms of homocystinuria? Answer: homocystinuria is a genetic disorder that affects the metabolism of the amino acid homocysteine. Symptoms can vary widely, but common signs include intellectual disability, developmental delay, and an increased risk of blood clots. Other symptoms may include vision problems, osteoporosis, and an increased risk of certain types of cancer. Question: what are the treatment options for Marfan syndrome? Answer: treatment for Marfan syndrome typically focuses on managing the specific symptoms and complications of the condition. This may include medications to control blood pressure and heart rate, surgery to repair or replace damaged heart valves or blood vessels, and physical therapy to improve flexibility and mobility. Genetic counseling may also be recommended for those with the condition, as well as their families. Question: how is homocystinuria treated? Answer: homocystinuria is treated by managing the symptoms of the condition and preventing complications. This may include a low methionine diet, vitamins B6 and B12, and a medication called betaine. Genetic counseling may also be recommended for those with the condition as well as their families. It is important to work with a healthcare professional to develop an individualized treatment plan that is tailored to your specific needs. Question: how is Marfan syndrome diagnosed? Answer: Marfan syndrome is typically diagnosed through a combination of physical examination, family history, and genetic testing. A healthcare professional may look for certain physical characteristics associated with the condition, such as a tall and thin build, long fingers and toes, a curved spine, and a sunken chest. They may also take a detailed family history to look for patterns of inheritance. Genetic testing can also be done to confirm a diagnosis and identify the specific genetic mutation responsible for the condition. Question: how is homocystinuria diagnosed? Answer: homocystinuria is typically diagnosed through a combination of blood tests and genetic testing. A healthcare professional may perform a blood test to measure the levels of homocysteine and other amino acids. Genetic testing can also be done to confirm a diagnosis and identify the specific genetic mutation responsible for the condition. In some cases, a urine test can be done to check for high levels of homocysteine. Question: what is the prognosis for someone with Marfan syndrome? Answer: the prognosis for someone with Marfan syndrome can vary widely depending on the severity of their condition and the specific symptoms and complications they experience. With proper treatment and management, many people with Marfan Marfan syndrome are able to lead normal, healthy lives. However, some people may experience serious complications such as heart problems, which can be life-threatening if not treated properly. Question: what is the prognosis for someone with homocystinuria? Answer: the prognosis for someone with homocystinuria can vary widely depending on the severity of their condition and the specific symptoms and complications they experience. With proper treatment and management, many people with homocystinuria are able to lead normal, healthy lives. However, some people may experience serious complications such as blood clots, which can be life-threatening if not treated properly. It is important for individuals with homocystinuria to work closely with a healthcare professional to develop a treatment plan that is tailored to their specific needs.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the First Aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.